ORT is a respiratory disease of poultry caused by the bacterium Ornithobacterium rhinotracheale. The disease mainly affects chickens and ducks, but can also infect other poultry species. It is one of the diseases that causes great economic losses in the livestock industry, reducing growth rate, negatively affecting fertility, product quality, and has a high mortality rate if not treated promptly. Currently, the weather in the north is getting colder, causing the resistance of chickens to decrease, creating favorable conditions for disease-causing bacteria to develop. Therefore, ORT disease is breaking out in many provinces in this region. Farmers need to proactively prevent and detect the disease in time to minimize damage. Let's learn more about this disease with Dr. Vet. ORT disease is also known as purulent pneumonia in chickens. The disease often occurs at the time of changing seasons, especially at this winter season, when the temperature drops. The resistance of chickens decreases, and at the same time farmers close the coop. The amount of toxic gas in the coop is large, cannot escape outside, so chickens are more susceptible to respiratory diseases. Broiler chickens often get sick at 3 to 6 weeks old. Other types of chickens are usually from 6 weeks old and up. The infection rate is high from 50 to 100%, but the death and elimination rate is low from 5 to 20%. Symptoms: because the bacteria directly affect the respiratory tract and lungs of chickens. When bacteria enter the chicken's body mainly through the respiratory tract, they multiply and develop in the respiratory mucosa and then reside in the target organ, the lungs and main bronchi. So sick chickens often have typical symptoms such as chicken has very high fever, difficulty breathing, lethargy and reduced appetite, watery eyes, runny nose. The chicken was suffocating, shaking its beak, stretching its neck to breathe, and gasping for air. Nose has inflammation. Die in a falling back state fat corpse. For young poultry, the disease causes infection and brain hemorrhage, causing sudden death. In chickens over 12 weeks old, the disease causes acute pneumonia, arthritis, difficulty walking, pus or joint fluid, and a mortality rate of up to 50%. Laying hens, egg drop, premature laying, thin eggshell. There may be diarrhea and inflammation on the floor of the cage. About pathogenesis: tracheitis, pneumonia, bronchitis with thick pus blocking both bronchi, causing difficulty breathing, respiratory obstruction, air bag is destroyed, arthritis with pus in the joint, enlarged liver, bleeding. About disease prevention: clean and ventilated barns. Periodically spray disinfectants in barns 1 to 2 times per week with iodine at, according to the manufacturer's dosage. Ensure clean food and water, balanced nutrition, and should use deodorizing minerals or probiotics to treat odors, as well as toxic gases in the barn. Farmers can use biopharm or stop odor products. Periodically supplement garlic essence, Sierra garlic or glucan C, according to the manufacturer's dosage to increase the chicken's resistance. Treatment: when there are signs of disease in poultry, farmers need to pay attention to taking good care of the chickens and increasing their resistance, and follow the following regimen to achieve the best treatment results. About day 1. In the morning, mix into drinking water phenixine oral, according to the manufacturer's instructions, to help chickens loosen phlegm, reduce inflammation, and reduce fever. Or use Brom 20 WS to help loosen phlegm, combined with Peramol 100 WS to reduce fever. Use according to the manufacturer's dosage. Give glucan C to increase resistance. Help chickens recover quickly. In the afternoon, continue giving expectorant, anti-inflammatory, fever-reducing and immune-boosting medicine. Inject a pair of Ceftifa Powder Plus and Genta 50-inch. If the case is severe, you can add Interspectin L to inject into the chicken flock, combined with Energy 300-inch to increase resistance, recovery, increase strength, and help chickens recover quickly. Or you can inject a combination of Azacin 100 with Genta 100. Add Energy 300-inch to increase resistance, recovery, strength, and help chickens recover quickly. About day 2, continue treatment as day 1, If the chicken has no fever, you can stop taking the fever reducer about day 3, 4, 5 to completely cure the disease. You can give the patient Doxaline 500 WS and Sulmotry WS for 3 more days to completely cure the disease and prevent secondary diseases. Recently, Dr.Vet and the people have learned about ORT disease, or pustulosis pneumonia in chickens, and effective ways to prevent and treat the disease. We hope to bring a lot of useful informer shown to the people. Thank you for your attention. Goodbye and see you again.